Good afternoon, student. Today we are here to discuss about the topic of the external ear and the tympanic membrane. I am Dr. Shanti Padamal, demonstrator in the Department of Anatomy, Rampur Government Medical College. Today we will learn about the external ear and the tympanic membrane. We all know that ear, it has some part which helps us for hearing and helps us to maintain equilibrium. We all know it. It also helps to orientation the position of the head in relation to the gravitatory force. In evolution, ear is meant at first only for equilibrium, but as the evolution proceeds, organ of hearing becomes associated with it. So come to the introduction. It is well developed. Our human ear is well developed and well protected. And for hearing, it needs a sound source, conducting mechanism in organ and a central processor. And the conducting mechanism, it starts from this environmental air, and the auricle or the pinna, it helps to collect the sound waves and conduct them to the external ear, and from the external ear the sound wave goes to the middle ear and then the central processing unit. Then come to this parts of this ear. The ear, if you go to this picture, it has three parts. One is the external ear, middle ear and the inner ear. The external ear, it ends medially at the tympanic membrane, and the middle ear, it consists of the tympanic membrane and the auditory ossicles, Malleus, incus and stapes, middle ear cavity and the eustachian tube. And the inner ear, it contains the oval window, round window, cochlea and the semicircular canal. Today's topic is the external ear. So come to the external ear. The parts of the external ear. The external ear, it composed of the auricle or pinna and the external auditory canal. The external auditory canal, this part is the external auditory canal. It is external auditory canal. 1 minute. And the tympanic membrane. External auditory canal and the tympanic membrane. And this part, this is the auricle or the pinna, and this is the external auditory canal, this part, and this region, this is the tympanic membrane. Then come to the auricle or the pinna. The auricle or pinna, it is the visible part which lies both sides of your head, and it acts as a collector of sound wave and conducting them to the external ear. And the part of this external ear, part of this auricle or the pinna, this part, this is the tragus, and this part, this is the helix. And near the mandibular area, near the mandibular end, this part, this is the mobile part, this is the lobule, the tragus, and just behind the tragus, this is antitragus. And inside this helix, this is one elevation, this is the antihelix. And there is two fossa, one is the scaphoid fossa and the triangular fossa. And this part is known as the concha cymba and the concha cavum. Okay, and in between this tragus and the antitragus, there is one depressed portion. This is known as the intertragic notch, and this part is the superior crus and the inferior crus. This is the part of this auricle or the pinna. Then come to the muscle, ligament and the cartilage. The auricle or the pinna, this part, it composed of the extrinsic and the intrinsic ligament. The extrinsic ligament, it connect this auricle to the temporal bone. It is anterior and the posterior, and the intrinsic ligament, it connecting the different part of the cartilage. This intrinsic ligament lies in this portion, it connecting the different part of the cartilage, and the extrinsic ligament, it is lies anterior and the posterior. Then come to the muscle. If you go to the slide of this muscle, these are the muscle 1, 2 and 3. These are the extrinsic muscle of this auricle. There are auricularis anterior. This is the auricularis anterior, auricularis superior and the auricularis posterior muscle. Among these, this auricularis anterior and the auricularis superior, it arises from the epicranial aponeurosis, but this auricularis posterior, it arises from this mastoid part of this bone. And among these, there are some intrinsic muscle also, which lies inside this cartilaginous part. Okay. Then come to the cartilage. Part of this here. Okay. The cartilage, it is a single piece of elastic fibrocartilage with eminences and depression. It is covered by thick skin without any subcutaneous tissue. Okay. Lobule. It is the lowest part of the auricle without any. The lobule. Come to the lobule. So this is the lobule. It is the lower part of the auricle without any cartilage and consists of fibroareolar tissue covered by the thin skin. The most of the part of this here is covered by the thick skin, but the lobule is covered by the thin skins. Sometimes it is utilized by the doctor to take blood samples, and because it has less blood supply, so the patient experience lesser pain. Okay. Then come to this arteries, arterial supply of this auricle. The posterior auricular branch of the external carotid artery. This is the posterior auricular branch. This is come from this external carotid artery. It provides blood supply to the auricle. And a anterior auricular branch of the superficial temporal artery. And the superficial temporal artery, it provides anterior branches, which provide blood supply to the auricle or the pinna. And sometimes a branch from the occipital artery. The occipital artery comes from behind and it provides nutrition to the cranial side of this pinna or the auricle. Then come to the lymphatic of this part. This drain into the parotid, mastoid and the upper deep cervical lymph node. Okay, upper deep cervical, parotid and the mastoid lymph node. This nerve supply of this auricle. It is shaded in different color. This part, this one. It has two supply, sensory supply and the motor supply. The sensory supply mainly from the great auricular nerve and the lesser occipital nerve. This part is the lesser occipital nerve, and this is the, and this part is the, this part, only this part, it is supplied by the lesser occipital nerve, and most of this pinna, most of this auricle on cranial side and the facial side is supplied by the great auricular nerve. The great auricular nerve and sometimes the facial surface by the auricular branch of the vagus nerve. Sometimes vagus nerves also supply this part. Vagus nerve, this region supplied by this vagus nerve, and branches from the auriculotemporal nerve. Sometimes this auriculotemporal nerve which provide some sensory supply to this region. Okay. Then come to the motor supply, the temporal and the posterior auricular branch of the facial nerve. The facial nerve, it provides the motor supply to this auricle. Okay. Then come to this external bony canal. External bony canal. This external bony canal, it has two parts, cartilaginous part and the bony part. Okay. The cartilaginous part and the bony part. And definition of this external auditory meatus, or it is the outermost portion of the three part of the ear, external auditory meatus. Extension, it extends from the bottom of the concha up to the, it extends from the bottom of the concha, it extends from this bottom of the concha to the tympanic membrane, which separate the external ear, which this tympanic membrane separate the external ear from the middle ear. It is about 2.5 centimeter. It is about 2.5 centimeter in length. If you measure from the tragus, it is about 4 centimeter, and it is S-shaped. On cross section, it is oval. It has mainly three parts: parts external, parts intermedius, and the parts internal. This parts external, it is directed forward, upward, and medially. Forward, upward, and medially. And the parts intermedius, it is directed backward, upward, and medially. And the last part, the pars interna, it is again directed forward, downward, and medially. So the pars interna and the pars external, this part and this external part, the pars internal and the pars external, direction of these two parts are same. But the pars intermediates, it directed backward, upward, and medially. The parts, again I say, this is the cartilaginous part and the inner bony part. The cartilaginous part, this part is the cartilaginous part, this area, and this area, this part is the bony part. So there are two constriction in this canal. One is this region and one is just lateral to this tympanic membrane. This region means it is the junction of this cartilaginous and bony part, this part. There is one constriction, and another called the isthmus, like this region, another called the isthmus, a bony part 2 cm away from the concha, 2 cm away from this region, 2 cm away from the concha. It is about 6 mm lateral to this tympanic membrane. This is known as the isthmus of this external auditory canal. Then come to the cartilage description of this cartilaginous part. The cartilaginous part, this part is the cartilaginous part. It is about 8 mm in length. It extends from the cartilage of the concha, laterally from the cartilage of the concha to the cartilage is attached to the outer margin of the bony part of the external ear to the junction of this cartilaginous and the bony part. It is deficient in the upper and the posterior part, and this gap is filled by some fibrous tissue. On the inner surface of the anterior wall of the cartilage, there are some horizontal groove through which infection from the parotid gland may reach the external ear. Here in this anterior wall, there are some groove, and this groove provide a path for infection which comes from the parotid gland and may reach the external ear. Then come to the bony part. This bony part, it is about 16 mm in length, directed downward, forward, and medial. Laterally, it is the margin where this bony and the cartilaginous part join, and then medially there is tympanic sulcus, which is a deficient above. The tympanic sulcus medially, the tympanic sulcus. In this tympanic sulcus, the tympanic membrane is attached. So you may call the medially it extends to the tympanic membrane. The tympanic membrane, one important point, the tympanic membrane is placed inside this canal obliquely, making an angle of 55° with the floor, and also because the anterior margin of the membrane is slightly medial to the posterior margin, the floor, this floor part, this floor of the bony part is bigger than the roof. The roof is the shorter and the floor is the longer. And the interior of the bony part is longer than the posterior wall. The formation of this bony part, anterior wall, floor and the lower part, this anterior wall, floor and the lower part are formed by the tympanic plate, and the roof and the upper part of the posterior wall formed by the squamous part of the temporal bone. When you go through this temporal bone, you already read it. This roof and the upper part, it is formed by the temporal bone, and the anterior wall, floor and the lower part of the posterior wall formed by the tympanic plate. This whole of the canal is mainly lined by this skin. The skin also lines the outer surface of the tympanic membrane. The skin covering whole of this area, the skin also covers this outer part of this tympanic membrane. The skin is adherent to both cartilaginous and bony part of the external ear. Okay. When come to this region, this part of the skin which covers this cartilaginous part, it contains some subcutaneous tissue, and the subcutaneous tissue also contains ceruminous gland which secrete earwax, and this earwax, it may get impacted inside this canal, or naturally it goes outside the canal and keep the area moist, keep the area germ free. Okay. Then come to this next slide. Okay. Fissures of Santorini through the parotid or superficial mastoid infection can appear in the canal of or vice versa. Previously I told you there are some fissures of this anterior wall through which the infection from the parotid come to this external ear. This is known as the fissure of Santorini. This is the bony part. This bony part, again we can told you, this bony part, it is devoid of skin appendage like the ceruminous gland and the hair. So the folliculitis or furuncle mainly occur on the skin of this cartilaginous part. Okay. Then come to this relation of this bony part and the cartilaginous part. Enter to the cartilaginous part like the neck of the mandible, separated by the parotid gland, part of the parotid gland, and the bony part. Above this bony part, it lies the medial cranial fossa. If you go through this temporal bone, you find it. This above this bony part lies the medial cranial fossa, and behind it lies the mastoid ear cell. And posterolateral part of the deepest area of this external ear lies the mastoid antrum. So this mastoid antrum can be approached by the transmitter root also. The arterial supply of this part, again arterial supply, if you come to the arterial supply of this part, the superficial, temporal and the posterior auricular branches of the external carotid artery supply the part, some part of this external canal, external auditory canal. The superficial temporal and the posterior auricular, it provides the blood supply to this area, and the deep auricular branch of the maxillary artery. This is the maxillary branch, deep auricular branch, which provide nutrition to the deeper part of this, or this inner part of this external auditory canal. Okay. And the venous drainage, the veins drain into the external jugular vein and the maxillary vein and pterygoid venous plexus. Again come to the lymphatics. The lymph vessel drain into the superficial parotid lymph nodes, particularly to one in front of the tragus. One in front of the tragus. As we should identify this tragus and the lymph node, superficial parotid lymph node, and the mastoid lymph node lies behind the ear, and the upper deep cervical lymph node. You may find it, the upper deep cervical lymph node near the base of the mandible. Then come to the nerve supply of this area, bony part. Again come to the nerve supply. Upper and the anterior part of the auriculotemporal nerve. This auriculotemporal nerve supply this upper and the anterior part. And the lower and the posterior part, auricular branch of the vagus. This part is the auricular branch of the vagus. It is the which part? The lower and the posterior part. The lower and the posterior part, it is supplied by this auricular branch of the vagus, and this upper and the anterior part, it is supplied by this branch of the auriculotemporal nerve. Then come to the development. Though this diagram is not clear, but you should be minded that it is ectodermal in origin and developed from the depressed first branchial cleft, like this region, first branchial cleft. It is ectodermal in origin, the external ear from this side. So this is ectodermal in origin and developing from the depressed first branchial cleft. Okay. Then come to this applied anatomy. A small abscess called furuncle in the external ear causes acute pain because the skin being attached to the bone and to the cartilage, skin being attached to this bone and the cartilage, and so the pus cannot expand it, and thus causing tension of the skin and result in the acute pain. Or pain from the external ear may be radiated to the temporomandibular joint and teeth of the lower jaw and vice versa, because all these three structures are supplied by branches from the mandibular nerve. Due to the vagus nerve which supplied this lower portion of this external auditory canal and this some part of the posterior region of this external auditory canal, if the posterior wall is irritated, it might lead to vomiting and palpitation because it irritates the vagus nerve. So this is all. Then come to the one point also. This is applied anatomy. When the earwax develop and goes to the deeper part near this tympanic membrane, it is difficult to remove because there is one depressed part near this tympanic membrane, mainly in the anterior portion of this external auditory canal. This is known as the anterior recess, and if the foreign body or the wax is impacted in this region, it is very difficult to remove this foreign body or the wax. So this is the external auditory canal and the pinna, and then come to the next study period for this tympanic membrane. Okay, thank you.